Okay, we're here. I'm so excited. But before we even start, for anyone who's new here, I'm Steph. I'm intuition dietitian, people know me as. I am a neurodivergent friendly, neurodivergent affirming dietitian who focuses a lot on convenience and accessibility. And I wanted to bring Samina on today to talk specifically about all things related to gut health. So could you give the audience a little introduction?
Yeah. Hi, my name is Samina Qureshi. I am the registered dietitian and founder of Wholesome Start, a virtual nutrition practice based in Texas. And I specialize in supporting individuals navigating both disordered eating and GI disorders, including IBS, SIBO, chronic constipation, the bloating, diarrhea,
All
liver
the
disease,
things.
GERD, dyspepsia, gastroparesis, celiac disease, you name it, I will help
Yes.
you without a side of diet culture.
Love.
I'm also the co-author of Comprehensive Nutrition Therapy for Co-occurring Gastrointestinal and Eating Disorders. So I provide a lot of guidance and training for clinicians and helping people manage the intersection of eating disorders and GI conditions. And I also practice from a weight inclusive and culturally responsive approach to nutrition, where I love empowering my clients to gain relief from their GI symptoms without rigid diets, stress, guilt, or shame.
Period. That was an amazing introduction. I just have to like give you your flowers for that. I feel like that was like so beautiful and spot on and summarizes exactly why I wanted you of all people to come on the pod and talk to my audience, because I think you have enough of a trauma informed lens, and it's in your Instagram handle. You're an inclusive IBS dietitian, and I think in the gut health space and any of the kind of more medical nutrition side of things, right? Where there's like literal diagnoses that we need to be considering in our nutrition recommendations, can get real sticky in remaining inclusive and accessible and not being triggering for people maybe who struggle with eating disorders. So you kind of having all of those different intersections just felt like the perfect fit for you to come on and educate my audience a little bit more about all things related to IBS, gut health, etc. So let's get into it if you're ready.
Yeah, let's go.
Cool. Okay. So before we started recording, I kind of asked you what were some things you think would be relevant to my audience, and we have a list. I think I want to start with some of the foundations of gut health. I think it's such a hot topic and there's so much misinformation. And like many aspects of nutrition, the fundamentals are totally neglected in the conversation. So if someone is experiencing gut health issues, super broad explanation, what are the foundations they should first consider before looking into some of these maybe more intense interventions?
Yeah, absolutely. I think one thing that everyone should know about gut health is that our digestive system loves consistency,
Mm-hmm.
right? And what that means is offering our bodies regular and consistent nourishment so that it feels comfortable, so that it feels relaxed and stress free, right?
Right.
Coming from a place of, oh, I'm going to not eat or skip a meal because of a digestive symptom is only going to aggravate that symptom further. And
Yes.
so just getting the foundation, you were saying like the foundation, right? It's really going to the basics, back to the basics of nutrition. Like, are you eating in enough times during the day to even meet your nutritional needs? Are you eating consistently enough and not waiting long period of time so that it doesn't slow down your digestion and make the constipation and bloating and pain and all the symptoms worse? So, are you eating? When was the last time you ate?
Right, right. Which for my audience is always something relevant. But before we started recording, I literally was like, they need to hear it from someone other than me. So like, please mention that. But it makes sense, right? If you are essentially for certain periods of time, like starving your system of essential nutrients that it needs to carry out processes, then the likelihood of your digestive system being able to function optimally, it's not likely. So before we jump into like those over complicated interventions, uh, and I see this all the time where someone goes to their PCP or even a GI doctor experiencing symptoms, they get maybe an IBS diagnosis or they get no diagnosis and they're just told to cut out FODMAP foods or kind of those generic recommendations. The entire time they're like not eating consistently, they're meal skipping, they're overeating, like binge eating, etc. So I'm always telling people before we get into the crazy interventions that will require probably a little bit more labor, let's start with the thing that you definitely need. And that's going to help you, I feel like, identify the actual root cause of your symptoms, right? Is it just the fact that you aren't eating consistently and you have sporadic eating? Or now that you're eating consistently, do you have more clarity on what exacerbates your symptoms?
Oh man, yeah. One thing I like regularly say is you can't heal a starved gut with more restriction.
Yeah.
So if you're going into that GI doctor or PCP appointment saying like, "Oh, I have all these symptoms," and you know that you're not having breakfast, lunch at dinner and dinner at minimum,
Yeah.
you got to take a step back.
Yeah, absolutely. Which I feel like is a good segue to what we were talking about surrounding like IBS in general and how to approach understanding that diagnosis more. I think that there's a lot of misunderstanding about that diagnosis out there. People being underdiagnosed, also overdiagnosed. And I think people don't, I don't think that GI doctors do the most fantastic job at explaining that diagnosis to patients. So for those folks that are listening who have at some point or another been diagnosed with IBS or had suspicions of having it, what even is it?
Yeah, yeah. So in general, getting a diagnosis for IBS is difficult,
Yeah.
right? For many reasons. IBS is categorized by stomach pain. It is a disorder of gut-brain interaction, which means there's a miscommunication between the brain and the gut that is causing these symptoms. The primary symptom is stomach or abdominal pain and
Pain.
cramping, right? With altered bowel movement. So you can have IBS, constipation subtype, IBS diarrhea subtype, or you can be the lucky unicorn that gets IBS mixed, which is a little bit of both,
Yep.
right? Who doesn't want it all? No,
Right.
we don't. So yeah, IBS, a lot of my patients also come in with either self-diagnosing themselves with IBS or their doctor just like mentioned, oh, you probably have IBS, and so they run with it. Right. And here's the thing. I
Right.
lost my train of thought.
No, I hear you. No. So
So
go ahead.
if you think or you have IBS, what I wanted to say was many of my patients say that they have IBS, whether diagnosed or not, and they don't present with abdominal pain. They're just coming in saying like, I'm bloated, I'm
Hi,
farting
tummy.
it up, my stomach is hurting, every time I eat it hurts, I'm constipated, or I can't not be in the bathroom. I'm just like, everything I eat is coming straight out as liquid,
Right.
these types of things, but they don't present with that abdominal pain. It's not IBS. It could just be irregular meal patterns. Maybe you're lactose intolerant or something else could be going on.
Yeah. So if somebody is experiencing those symptoms, maybe not fully diagnosable for IBS, because I will tell you with my audience, that's what I'm seeing the most is like the diarrhea, constipation, or both. And the bloating is something I hear often, which is a whole other conversation, I'm sure.
Yeah.
But for somebody who's experiencing, and they're just like, okay, I don't know what's going on, but I know it's not right. I know this isn't how my digestion should feel. What is some advice you would give them aside from like fighting for a diagnosis? Because here's the other thing. I think that when the fundamentals are missing, the risk involved in playing around with some of those basic, more fundamental interventions, there's not a lot of risk, right? They're fairly safe to explore on your own. And I feel like a lot of people that are following me are dealing with such limited bandwidth that like sometimes they exhaust themselves in a fight for answers and diagnoses and advocacy in like with their medical professionals, and they have nothing left to dedicate to actual interventions. So like before someone exhausts themselves with trying to get a bunch of tests and scans and exams, what would you recommend they focus on outside of just that? I mean, I know we already touched on regular, consistent eating, but what about things like pattern recognition, data collection, that type of thing?
Yeah, absolutely. I think like with IBS, there's a hypersensitivity, right? You're experiencing heightened symptoms, and the stress of that can also go into feeding the symptoms, right? So we do want to make sure that your nervous system is regulated, that your mental health is kind of at a place where you feel confident and comfortable to even address this. So yeah, if this is overwhelming you, first and foremost, like manage that so
Yeah,
that we can think clearly, so that we have our body in that rest and digest phase where we're not triggering our digestive symptoms simply because of our
stress.
mental state and stress, right?
Yeah.
Which is very real. And then from there, if you feel like, hey, okay, I'm in a calm place, I'm going to take a week to really understand how my symptoms present. You can absolutely do like a food and symptom journal where you simply like write down, okay, for breakfast I had peanut butter and waffles and like almond milk, didn't have any diarrhea. Then I had my coffee, straight diarrhea. Okay, didn't have any stomach pain after lunch. Kind of log your symptoms in real time. And I think that's the key thing is like not waiting to the end of the day because half of the time I don't even remember what I had for breakfast. Like,
Right. Right.
right.
And
So
when that
if you're
exact symptom
eating,
may be surfaced in relation to when you ate, like if you're doing it retrospectively, like you're gonna get
yeah. So if you can take the time to just really tune into your body and see, like, hey, what's going on here? Um, that way you can then even take that information to
that's what
your
I was saying.
PCP, to your GI doctor, to your dietitian. I mean, this is the piece that I help my clients with
Right.
is the food and symptom journal and really understanding their symptoms because a lot of the times just like you, my clients are very busy, overwhelmed, stressed, and nourishing their body ends up being on the back burner. And
Yep.
so going back and working together on that consistency of intake and nourishment and seeing how that impacts your symptoms and then taking that like quality information to your doctor to
Yeah.
really assess what's going on can
Yep.
help you honestly not spend so much money on like an endoscopy, on a
Yes.
colonoscopy, like these things that
Yes.
are thousands of dollars, like that are
Yes.
expensive.
That's I think where I was getting at too is like the cost of it all as well, like both financially and mentally, emotionally to seek these diagnoses out. I also think that um, independent of getting an official diagnosis, if you have a dietitian that you can bring that journal to or who can help you facilitate that journaling and help you with the pattern recognition, the likelihood of your dietitian being able to help you explore interventions and alleviate symptoms is like likely, pretty
Yeah.
likely. So maybe I'm biased, but like if you're going to take that information anywhere, like maybe a dietitian is a good place to do it.
Yeah, absolutely. That's our jam.
Yeah, yeah, especially like obviously a gut health focused dietitian. But so okay, that was all so helpful. Kind of related, not so related, but like when I'm thinking again of my audience, the people that are consuming the content that I put out there, some of the common experiences related to gut health that I'm seeing the most are like this AM nausea, the constipation, or like mixed constipation diarrhea. And then also there's stimulant use. Maybe we'll talk about stimulant use after, but like the AM nausea and
Yeah,
the constipation diarrhea, let's talk about
tackle
those.
it. Yeah. So morning nausea, right? You wake up, crap, I'm nauseous. Oh my God, that sets the tone for the day. If you're nauseous, sure as hell not eating, right?
Right,
Wrong. So I would
right.
love for you to get ahead of it in the sense of before you even turn your body to roll out of bed, get up, use the restroom, if you can put something in your mouth, if it is a saltine cracker, peanut butter cracker, banana, Gatorade, water, something with nutrients to um, mitigate the nausea. It could just be your body telling you it's low blood sugar and you need to nourish it.
Right. I find that like anything drinkable tends to, obviously if you have like lactose intolerance or something, like that's a different story, but something drinkable and something shelf stable, especially that you can keep like bedside so you don't even have to get up, can be a really great way to get that nourishment in beforehand. Yeah, because when we're talking about, okay, foundation of gut health, consistent regular eating, one of the biggest barriers that people are experiencing to that is this like morning like lack of appetite slash nausea, and to the point of food aversion, right? Like they think about eating and they're like, ugh, like I can't even fathom eating right now. That is when you know there needs to be some eating happening, but it doesn't have to be you making a egg sandwich or something. It literally just
Yeah.
means drinking some electrolytes, having some water, especially the more nutrients in it, obviously, I think the better. The Gatorade, the crackers, and
Or
releasing.
any like,
Go ahead.
I was gonna say any dried fruit, right? Like there's shelf
Yes.
stable if you wanted to keep dried apricots, some dates. They're like micronutrient rich and give you that
Yes.
burst of like sugar that you need.
Yes.
Um, that could be a good option too.
That's a
Sorry,
great
go ahead.
option. No, I love that option. I've actually never, I don't think, said the dry fruit, and that's a no, an amazing option. But I think there's an expectation that when we say eat something, that we mean eat a meal, and that's certainly not what we're meaning. Food in belly, something in belly, is really what we're talking about, and let that be the only expectation, and play around with what alleviates that sensation of nausea the most, and an hour or so later, how is the thought of food sounding? Is it sounding a
Yeah.
little bit better? Can you have a little something from there, like baby step it? But absolutely, if you feel like morning nausea or morning like food aversion, lack of appetite is a barrier for you, I promise you, getting something into your body, something that's easy to get down, is the way to go.
Yes. And I will say, when I was pregnant multiple times, the nurses would say I have a lot of bad like morning sickness, and they would be like, okay, when it's really bad, just carry the like alcohol swabs like with you and smell them to like divert the nausea and like shock your system to like avoid
Yep.
it.
Yep.
Aside from that, you don't have to do that at all. It's not like snort, just pure alcohol
Right.
fumes. Um, Candied ginger. So ginger has been
Yes,
shown to really be
ginger.
helpful with nausea. And so whether that's like ginger tea, candied ginger, even the candied ginger chews, if you're like, okay, can't do anything, I can suck on a hard ginger chew. That will
Right.
be the small step you take to then putting the next thing in your mouth,
Right.
right? It'll help open that door and make it easier to nourish your body the rest of the day.
Right. I just think that there is so much expectations for the changes to be drastic, right? I mean,
Mm,
everyone wants these processes to move faster. And if you want, the changes that you're making, especially when it comes to dietary patterns, to be sustainable, like the slower you take them, the better. So like I said, release the expectation that you're going to be eating a full, well balanced breakfast anytime soon. And if you're someone who experiences that like lack of appetite and morning nausea, and just start exploring ways to get closer and closer to consuming something. Yeah.
yeah, totally.
Okay. So similar to the AM nausea, now they, didn't eat all morning. It's lunchtime. Maybe they're eating for the first time then, or maybe they're not even eating till dinner, but they have had a coffee. Don't worry about that. That's always there somewhere. So, or an energy drink, some type of caffeinated beverage. And now throughout the day, they are experiencing stomach pain, constipation. Um, what are your thoughts on those symptoms?
Yeah, so the only logical thing for our bodies to do after a period of what I'm going to call starvation, even
Yep.
for a shorter period of time, is to eat quickly,
Yep.
get enough nourishment in as quick as possible. And what that does is, let's say lunch or dinner time, by the time you eat, is you're inhaling your food, right? Digestion starts in the mouth. Chewing is so important to really help the food go down easier,
Yep.
right? And in our saliva, there's salivary amylase, an enzyme that
Emily,
does
we
help to
love
break down those
her.
carbohydrates, right?
We love
So,
her.
yeah, if you are taking 2 bites of a burger and swallowing it,
Yeah.
it's likely that you could experience some GI symptoms. We want you to chew enough so that it feels easy to swallow and not like chunks going down.
Right.
Right. And that's the first step, right? So make sure that you're chewing enough. Make
Do
sure
you
that you
find,
are.
oh,
Mhm.
sorry to interrupt. Do you find that the not chewing enough is more related to just that like gastrointestinal stress, or do you find that that actually drives constipation specifically?
Great question. The stress, it would impact the GI symptoms, but for constipation, I know I kind of changed up the talk, huh?
No, no, no. You're
For
fine.
constipation, what could happen is that like with not eating long periods of time, our GI system, remember, loves consistency. And
Yep.
so anytime you go long periods of time without eating, it tells our digestive system that you don't have to keep working, right? So
Yep.
it may slow down to conserve energy because it knows that no energy is coming in. And what that does is make constipation worse.
Yeah.
And the longer that that poop is sitting in your colon, the harder and drier and more painful it will become as
Right.
it exits,
Right.
right? Because water is reabsorbed at that like end of your colon.
Yep.
And so we want to do everything possible to keep that digestion moving by eating more consistently and helping you have a little bit smoother, more regular bowel movements.
Okay, that makes total sense. You mentioned before we were recording that obviously that kind of like malnutrition piece, that like starvation, temporary starvation for parts of the day can drive that. But you also mentioned that it can be medication induced. Tell me more about that.
Yeah, yeah. So depending on what type of medication you're on, whether it's like sometimes antidepressants, SSRIs. It could be a stimulant that you're on that just reduce your appetite so much that it feels like you don't want to eat anything. Absolutely, medication can impact constipation. So if that's something that you know is a side effect, then it's even more so important to focus on these foundations of like nourishment.
Totally. Okay. Um, I thought there was something else I wanted to ask you about that, but I guess not. I feel like that was a complete summary of these symptoms. Um, I think we should talk about the opposite of that digestive experience a little bit, because I do know a lot of my followers and clients are experiencing the diarrhea side of things. What do you kind of see be some of the main drivers for those symptoms specifically, or just tell us more about the mechanisms that kind of drive diarrhea?
Yeah, with diarrhea, it could be so many
I
things going
know.
on. I always like to focus on like your mental and emotional state during meal time. So really
Ooh,
setting the stage for a calm, nourishing environment. This doesn't mean like, oh, I'm going to like take an hour-long lunch and
right,
do all the things and eat mindfully. It's just like are you literally just going back to back in 4 hour meetings and the only thing you can do is scarf down that food and eat really quickly and not even take a breath? And
right.
some of that, sometimes when we again eat rapidly and have a lot of food in a short period of time, we can experience malabsorption, which
Mm,
can lead to diarrhea, especially if it's like possibly a higher fat meal. Maybe you're
yep,
having like a creamy pasta or like a fried chicken sandwich or something, and your body's like, I can't hold on to this. It's going to come out.
yep.
So, the balance of nutrients as well as the speed of eating, it could also be lactose intolerance, something going on, or the stressors in life leading to a little bit of that diarrhea.
Yeah, which I think is another reason why the idea of like food tracking, journaling, symptom tracking, I should say, to kind of help you recognize patterns can be so important, because you might notice that those diarrhea symptoms are happening, you know, on your work days only, or they're happening every time you eat dairy, or like certain foods trigger it. So that's another, I think,
Yeah. Especially with this like hybrid model of work that
yes,
like a lot of my clients are having to go back into the office now. Ugh, sucks. But
right.
like There's a pressure, right? Like if you experience digestive symptoms, sometimes you don't want to be in public, right? And I think like I always tell my clients, like if you're able to pass gas and use the restroom, like go for it. But then what happens when you don't have that freedom at work, where
Right.
you may have that like be a little shy to use the restroom or uncomfortable? You hold it in, you're holding in all that gas, you're holding in all of the poop, and then your body is going to be like, okay, I can't hold it anymore. And you may
Right.
experience diarrhea because of that.
Right. Yes, which I think is another important, actually, I'm glad you said that because I totally would have not thought of this, but it is super relevant to my neurodivergent population who experiences interoceptive struggles. For anyone who doesn't know what I mean by that, it means like experiencing and honoring your bodily cues. We tend to push those things off, using the restroom, eating. Like we might notice sensations of hunger, notice the urge to pee, and we don't honor it. And if you are somebody who's experiencing digestive symptoms, not honoring the most immediate
Urge.
cue is not going to help you long term. I think that's a super important thing to throw out there that I totally wouldn't have thought of unless you just mentioned that.
Yes. And then if you again are holding in your urge to use the restroom and it's a bowel movement and you typically present like on the constipation side of things, it's only going to make the constipation worse.
Yep. And if you have mixed symptoms, it's going to make both of those sides worse, most likely.
Yeah,
Yeah.
and the stomach pain will just you'll be miserable.
Yes.
I don't think I could sit through a meeting with a needing to diarrhea. It would be miserable.
Miserable. Yeah. So I think that's a really great thing to mention as well, because yeah, a lot of neurodivergent folks, we tend to get hyper fixated, hyper focused on a specific task, and we tell ourselves, let me just finish this and then I'll go. And then it's been 2 hours and we've not honored a single thing. We've not eaten, we've not gone to the restroom, we've not taken a sip of water. And yeah, I mean, if there's any digestive symptoms on board, it's going to make that worse in every regard, right? Not eating, not drinking, and not using the restroom, not a beautiful combo for supporting your gut health. So I'm glad we took a sec to talk about that. One more, like kind of one last thing I think is just more for funsies, and because I love nothing more than to like make fun of some of these like trends and things. What are some of your personal pet peeves around gut health, misinformation, some of the fads that you've seen or things you've heard from clients that you feel like is particularly damaging? Obviously, there's so much out there, so it's up to you. But yeah, what are some of the like fads and misinformation that you've come across around gut health?
Oh my gosh, there's so
So
many.
many, I know.
Number one, nobody in the world needs a colonic. Never do it.
There we go.
Right? One of my colorectal surgeon friends was like, man, you don't want to know how many people I have had to save because they have had a tear from getting a colonic and they need surgery. Like, that's so crazy. You thought you were just like, flushing the poop out and then you get a rectal tear or like an inner colon tear and it's bad.
The coffee enema thing
Yeah.
that's been going on right lately is just
Hmm.
unreal. That is a really good one.
There's
Parasite
more.
cleanse.
Oh my gosh, yes. Don't do anything that is a parasite, colon, anything that is a cleanse,
Well,
don't do it.
cleanse in general. In
Cleanse,
general.
detox, gut reset,
Yep.
don't do it. Don't do it. If
Another
it
word for
sounds too
laxative.
good, yeah, if it sounds too good to be true, like stick to Miralax,
Right.
Metamucil, fiber
Right.
supplements, you'll be fine.
Right.
You can absolutely rely on laxatives. That's not what we're saying.
Right.
It's find ones that are gentle and safe to use.
Yes, absolutely. What other trends came to mind for you?
Okay, other ones are okay. So, we are in the age where everyone wants to shift to a more plant-forward diet.
Hmm.
Awesome.
Yes.
However, for my people with IBS, what I notice, especially among the population that I work with that struggles with their relationship with food, they may experience, undiagnosed eating disorder and they want to follow a plant-based diet. And what they are eating ends up being all high FODMAP foods.
Yeah.
They're loading it up on lentils, loading it up on chickpeas, loading it up on chickpea based pastas. eating all of the health bars that have been infused with fiber, fortified with
Yep.
fiber.
Yep.
They're all great. These are all health promoting, but where is the balance? You can't eat 2 cans of chickpeas in one sitting and think you're going to be okay. I
Right.
think eating that amount of fiber for anybody, regardless of their diagnosis, would experience some flatulence or gas and digestive
Right.
distress.
Which I think is a good thing to mention too, as the fiber conversations are ramping up in the health and wellness space, which is something dietitians have been asking for years. So by no means am I complaining that we're starting to, like the masses are starting to understand the importance of adequate fiber intake. But just like anything else that happens in diet culture, you can take it too far, and that is not just in multiple ways, ramping it up too quickly, right? 0 to 100 with your fiber intake. If you're someone who has no fiber intake, and then you go from 0 to 100, and then also like macro dosing fiber, right? Having a
Yeah,
meal that's 50 grams and being like, oh, why I'm experiencing digestional distress. It's like,
yeah, yeah,
or only, relying on those really high fiber like products that have had a lot of fiber added to them, and then all of a sudden your meal turns into a 50-gram meal because you have your
yeah.
high fiber tortilla, a can of
Uh-huh.
beans, a huge thing of veggies, and yeah.
Yeah. Yeah. So fiber maxing, I think, is what's going around these
Yes,
days.
fiber maxing, oh my god,
Yeah, we
it's
don't need to
scary.
max anything. You just need to add some and get some in the day. It's fine. And I think another big thing is that, like, and maybe this is applicable to your population, you don't have to get fiber from fruits and vegetables, right? If you have a texture aversion, if you have a temperature, taste, whatever it is, right? You have some preferences, that's fine. How to get fiber can vary for each individual, and which type of fiber you tolerate, whether it's soluble or insoluble, is also going to be different for each individual, right? What we have found with IBS is that people with IBS better tolerate soluble fiber sources.
Mm-hmm.
So maybe leaning towards some of those that happen to be low FODMAP can be beneficial.
Yep.
Oatmeal, um, kiwis, certain fruits and vegetables, and even for the higher FODMAP fiber sources, I'm talking lentils, chickpeas, these types of things. It doesn't mean that you have to completely avoid them either. It's
Right.
again finding the right portion for you. So
I'm giggling to myself because I feel like this is the framework that dietitians have to explain information constantly, because we're just living in constant fear of someone taking it too far and letting go of the kind of underlying message that is like, it's literally about balance. Like, we don't know how else to say it. It's about, you don't need to completely eliminate things most of the time. Obviously there's
mhm,
circumstances where maybe things are medically necessary, but for the average population, it's not about completely eliminating things or about maxing things. It's just
yeah,
about getting a little bit of everything, and staying in, not in control, staying in tune with, how your body responds to those things, so you can, kind of naturally arrive at that balance that makes sense for you, which is different for every person. So
yeah. And on
yeah.
the topic of fiber, I know this isn't like a fad or anything, but just like information that people might find helpful is that fiber gummies are not always the same ingredients as like the same brand's fiber powder. So if we're
Yes.
just talking about like Metamucil, which is psyllium husk fiber,
Yep.
in the powder form, it looks like orange tang in a glass.
Yep.
You whisk it up and it gets thick. You got to drink it quick, right?
Yep.
A lot of people don't like that texture, and that's okay. So they're like, hey, let me try the gummy
The
form.
gummies.
The gummies might be fine for you, but if you know that inulin and chicory root fiber, a high FODMAP ingredient, triggers your symptoms of bloating, gas, stomach pain, diarrhea, or constipation, the gummy version might not be okay for you. And I just checked the Benefiber gummy fiber, and it also has
Same thing.
chicory root.
I always recommend starting with the powders. I've just found that they are better tolerated, and if you can find a way to consume those and comfortably, that's just probably a better and safer option than those gummies. But I actually wasn't certain why, and that makes sense. It's the chicory root
Yeah.
and the inulin, which totally makes
Yes.
sense.
Yes.
um
And those are Like these days, the fiber that they are fortifying fiber maxing
Every,
every food with is
yes,
chicory root and inulin. So if you are
yes.
noticing that, like, hey, I did fine with like the whatever balanced bowl I got from whatever restaurant, but that had possibly the same amount of grams of fiber, but I cannot tolerate the chicory root in this fiber one bar.
Yeah. Isn't chicory root is I think what's in a lot of the sodas as well. The like, okay, brief intermission for Samina to have a little cough attack and get a cough drop, and we're we're back. Honestly, we kind of talked about everything that we wanted to chat about. We were kind of ending the last convo about some of those high fiber foods being inulin, chicory root, and those two ingredients being, high FODMAP and particularly irritating for people who are struggling with IBS. So to beware of those high fiber foods and make sure that you're tolerating them. And just another reason to do some symptom tracking and journaling.
Yeah, absolutely. It can really help.
Any other pieces of
Yes.
information you think is important for them to know?
Yes, just because your doctor hands you an elimination style diet for a GI condition does not mean that you have to follow it.
Oh, that is
Whether
the
it's
best. That is the best advice.
whether it is the FODMAP diet, some other elimination style diet, whatever, if you are not starting off at these foundations, further eliminating FODMAPs is not going to help.
No. And I think that's a really great message in general for folks who are getting a diet handout from their doctor. Like, that is not scripture. Like, most of the time, that would be my last resort. And
Mm-hmm.
if there's
It
a
is
way,
my last resort too.
yeah.
Mm-hmm.
I've had, when I was working I worked in endocrinology, pediatric endocrinology clinic, and we were right next to GI, and I got some of the crossover patients. And I can't tell you the amount of times that I had a patient come in with a handout from their GI that I was like, we're going to go ahead and throw that away. We're going to
Yep.
go ahead and disregard every piece of information in there. So I think that that's a great reminder. Doctors are not nutrition professionals, and don't knock them for it. Obviously, they have their scope of expertise and they have valuable information to share with you, especially around diagnosing. But when it comes to how the dietary interventions related to your symptoms, you're going to have a lot more benefit for a lot less stress by getting that information from a dietitian.
Yeah, absolutely. I love that.
Speaking of getting that information from a dietitian, Samina, why don't you let the audience know where they can find you and what you've got going on these days?
Yeah. So if you're on Instagram, I am the inclusive.ibs.dietitian. And I am now accepting clients in my 12-week IBS Food Freedom package. It is a place for you to gain the support and kind of hand holding and guidance you need to better identify your food and lifestyle triggers, expand your diet, overcome food fears, and feel your best with digestive distress. And if you'd like to sign up, you can go to my website at wholesomestart.com and apply there, and we can get on a fun little discovery call and chat about what would be best for you. Also, I think earlier I had talked about the book that I co-authored, so I have it here. The EDGI Training Project, Comprehensive Nutrition Therapy for Co-occurring Gastrointestinal and Eating Disorders. So if you happen to be a dietitian, a therapist, a GI doctor, a psychiatrist, pelvic floor physical therapist, you name it, this book is for you.
Yes. I will drop all of the information that you just shared in the show notes as well in the description so people can find you that way. Thank you so much for taking the time to come on and share your expertise and for being one of the only voices that I know of in the gut health space that is, inclusive and trauma informed and, putting out advice that my audience can actually benefit from and apply. So I really appreciate you taking the time to come on. And I think that's it.